Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Hashimoto's thyroiditis is the most common cause of an underactive thyroid problem in developed countries, affecting about 1 in 1,000 men and about 4 in 1,000 women during their lifetime. Now, Hashimoto's thyroiditis is an autoimmune disease whereby the body makes antibodies that attack the thyroid cells, destroying them, which impairs the ability of the thyroid gland to synthesize and secrete optimal amounts of thyroid hormone. So the ensuing deficiency of thyroid hormone results in a slower metabolism with weight gain, decreased energy, dry skin, brittle hair, and a host of other unpleasant signs and symptoms. It also increases the risk of heart attack if left untreated. Now, over the years, studies have suggested that selenium supplementation may be helpful in managing Hashimoto's thyroiditis. Now, this culminated into a systematic review on this subject that was published in the journal Thyroid in February of 2024. Now, in their review of 35 studies involving patients with Hashimoto's thyroiditis, the researchers reported that selenium supplementation was significantly associated with decreased blood levels of TSH in patients not taking thyroid hormone medication. Now, lower levels of TSH means that the thyroid gland is working better and thus requires less TSH stimulation to synthesize and secrete thyroid hormone. So TSH is thyroid stimulating hormone that's produced by the pituitary gland. When the thyroid's not producing a lot of thyroid hormone, the TSH levels rise to try to encourage the thyroid gland to produce more thyroid hormone. So in hypothyroidism, where you have underactive thyroid, the lower the TSH level, the better. So patients using selenium supplements who had Hashimoto's thyroiditis showed this important outcome. Lower TSH blood levels, meaning that the thyroid gland was functioning better. Now, in many of the studies, selenium supplementation also helped to lower the levels in the blood of the antibodies that attack the thyroid gland. This is another very important outcome, lower autoantibodies against the thyroid gland. And selenium supplementation also lowered a key blood marker of free radicals. In other words, there's lower malondialdehyde in the blood, which says that there's less free radical damage going on. This is important because free radicals also damage the thyroid gland and make this condition worse. Now, importantly, no adverse effects were noted among the patients taking selenium supplementation to help manage their condition. A lot of patients ask the question, well, if I take selenium supplements, what could be the adverse side effect? In this situation, no adverse effects were noted. The typical doses were from 80 to 400 micrograms of selenium per day. 400 is a very high dose. The author stated, and I quote, "Our studies suggest that selenium supplementation is safe and holds potential as a disease-modifying factor for Hashimoto's thyroiditis-associated hypothyroidism." Now, in addition to supporting thyroid function, a brilliant review of selenium in affecting inflammation and immunity was published in 2012 in the journal Antioxidant Redox Signaling. Now, in short, these researchers provide detailed evidence from experimental and human clinical studies of the importance of selenium supplementation in preserving more optimal immune system function, especially as we age. Normally, the immune system gets weaker as we age. Selenium helps to keep the immune system much stronger. So better immune function translates into a lower risk of life-threatening infections like pneumonia, as well as in cancer risk. Other studies have shown that selenium supplementation can also help to prevent congestive heart failure, as we saw in a large recent Swedish study which combined selenium supplementation at 200 micrograms a day with coenzyme Q10 supplementation. Now, finally, an extensive review of the anti-cancer properties of selenium was published in 2020 in the journal Antioxidants, which highlighted the multifaceted ways in which selenium supplementation has been shown to block cancer development and progression in experimental studies. So taken together, my feeling is that most adults would benefit from getting 200 micrograms per day of selenium from a high-potency multiple vitamin and mineral, as I do. It's one more step that you can take to support your immune system function, your antioxidant defenses against free radicals, as well as supporting your heart and your thyroid function, and much more. So I've provided the links to the research papers cited in this update in the text below. Thanks for watching, and I'll see you next time.